My experience with the CSTEP internship here at SUNY Optometry has been amazing. I've met so many incredible people and it is such a supportive environment.
Students, the teachers, the doctors, I got to learn more about the OAT exam, the curriculums.
I had a wonderful experience through it. I shadowed multiple doctors and the students here. I made a network with them and learned about optometry field. And I also learned about diagnosis of eye and various kinds of disease.
In-person clinic experience and work with professionals, get networking, get to new people.
This was like the first internship I've done, and it provided like everything I wanted, from like clinical to research to education, and to like also connecting with fellow OD CSTEP students, and also gaining like a pathway, an idea of what the optometry field would look like.
I've learned a lot about eye care. I've gotten a lot of experience in both being an optometrist and being an optometry student, which I think is different than a lot of internships. I think it gives you like a overall view of what it's going to be like to go into optometry.
I really enjoy the workshops and the chance to shadow optometrists in different subfields of optometry. It gave me a deeper understanding of the field and helped me see the variety of paths within eye care.
My experience with the CSTEP Spring Internship has been really amazing. I really got to shadow student doctors and they taught me a lot about patient care.
I learned that you have to listen to the patient, you have to understand their problem, and I also learned that it's also not only a vision check. You also learn about their underlying health problems, and you can prevent some of these health problems from actually occurring.
The spring internship to me, I feel like in one word, was informative. A lot of things that I didn't feel like I really understood that well, I have learned here.
I didn't consider optometry as a potential career path, but I think just given how much exposure I got in like the past week, and also like learning about the AOT and like learning about like the clinic and like how SUNY Optometry is, I'm kind of really inspired and definitely considering.
Something that surprised me most about eye care, especially the field of optometry, is that how optometrists can specialize in so many fields such as contact lenses, pediatrics, and low vision.
Optometrists can often detect neurological issues just through an eye exam. So seeing the neurological side of optometry really made me realize how complex of a field optometry really is.
Just how eyes can like really tell you how good your overall health is, just because you can see your direct blood vessels in your eyes.
Like there's not only primary care, there's also vision therapy, contact lens, and also you don't only have to do clinical work, you can also do research and pursue a career in academia.
Eye care has surprised me a lot because it's very collaborative and genuine. Patients who come here are able to receive care for anything. Even people who don't have insurance are welcomed and treated with the utmost respect, and I really appreciate that.
I figured out that eye care isn't just about making people see clearly, it's way more than that. It's a lot of like chronic disease and just way more into like the eye.
It shows so many different aspects of overall health, and I think that what I didn't realize was optometrists are the first people who could identify systemic issues like high blood pressure or diabetes, and I think that it made me look at optometry in just a whole new light, not just as vision care but also an essential part of preventive healthcare.